Honestly, anybody who's just starting out at the beginning of their career, don't try and have all the answers now. Really take these first few years as like chances just to try things on, like figure out what you like, because what you learn about in school and even in your first couple of years of practice may not be what lights you up. It doesn't have to have that level of connection, but you have to enjoy what you're doing. And so I don't think that I could have predicted that this would become like my purpose and passion when I started, 20 plus years ago. Like, right or wrong, they're getting their healthcare information from social media. So I think being an evidence-based practitioner who provides educational content has a lot of value, even if it's not what goes viral. So I think that understanding that content creation isn't about quantity, it is always about quality. And I think the thing with a lot of marketing is that marketing is about selling your message. But I really started to think about my marketing differently and that I'm not trying to sell a product. I'm trying to help them feel seen and heard. I want to connect to them and at some point be part of their story so that they can kind of emerge from this transition with their own story. Instagram has been great for me because I think that as a people person, as an extrovert, and as somebody who's postmenopausal and gives far fewer shits about like what I look like and how I show up online and all that kind of stuff, it's a great platform for me. And I've made amazing connections with both practitioners and with patients and clients. And being able to really lower the bar with your expectations of what your content needs to look like is, I think, the hardest lesson, but also the most important lesson. I do think that it's always something that as clinicians, you always have to strike that balance between sharing parts of your story that might be relatable, might help someone to feel seen, feel heard, help them to feel like they can talk about something that might have been really difficult to talk about, and finding the balance between that and making it your story and making, your N of one, your anecdote become the data. And that giving people the space within that clinical setting and relationship to explore all the options without bias, without judgment, without fear of disappointing us as clinicians, because something that we suggested didn't work, I think is really how we build a really therapeutic healing relationship with our patients.